Good morning and assalamu alaikum to all our listeners and viewers this morning. You are tuned in to Salam Media Mid Morning Talk with your host, me, Fasi Hadovitz, for this week. Today's World Humanitarian Day, and we are particularly focusing on Sudan. The most recent reports from the MSF, that is Doctors Without Borders, is that Sudan's war is fueling its worst cholera outbreak in years. Over the past week in just the Darfur region, Doctors Without Borders teams treated over 2,300 patients and recorded 40 deaths of cholera at facilities run by the Ministry of Health. MSF is calling for an urgent and scaled up international response to provide healthcare, improve water and sanitation services, and begin cholera vaccination campaigns in affected areas. We are joined with Doctors Without Borders spokesperson Mitch Rhyner, the deputy head of the Sudan mission. Mitch, thank you so much for joining us today.
Thanks for having me.
Sudan is one of the hardest places, on earth right now for aid workers to reach. What are the main obstacles that MSF is facing in getting assistance into the country?
Well, the conflict is a major obstacle to doing our work and getting assistance into the country. We see regular airstrikes, we see conflict ongoing in several parts of the country. Also, looting is a major problem. So, just managing the risk related to the conflict itself is a major obstacle. Also, the infrastructure in the country, as partly as a result of the conflict, we've seen infrastructure go unmaintained, difficulties in passing roads. And then the third point is on the administrative barriers. Moving people, moving equipment, moving supplies into the country has also been a major difficulty in getting aid into the country.
Thank you so much for sharing that with us, Mitch. And just to latch with what you said, you explained these three barriers basically for aid workers and humanitarian workers like Doctors Without Borders to kind of get in and support what's happening to innocent people on the ground, essentially. Sudan, according to the United Nations report in 2024, last year, was recorded at the risk of famine, and famine was then declared in certain areas. What are the conditions like now in the Sudanese region?
The conditions remain very dire in many parts of Sudan. Of course, what we've seen in Darfur and the Kordofans is incredibly difficult for us to accept. Many people going without adequate food, without safe access to water, without access to healthcare, and to have their basic needs met. Particularly in places where the humanitarian sector has struggled to scale up, like North Darfur and Tawila in particular, but also the Kordofan states in the center of the country. The situation could not be much worse, and we're fearful that during this rainy season and given the intense fighting in North Darfur and the Kordofan states, that the situation could deteriorate, and we could see more spread of cholera, which, as you mentioned, is ongoing, and more disease outbreak in the country.
Yeah, really stressing the urgency that is required on the ground. And I want to kind of latch on that. So in April 2023 is when the fighting broke out between the two military groups, and that is, the Sudanese Armed Forces, SAF, and the Rapid Support Forces, which is a paramilitary group, RSF, in Khartoum, Sudan. And since then, the levels of the escalation increased drastically. And then I know that recently in 2024, there was some sort of like calming down of the conflict. Where's it now? And how is the ongoing fighting between groups specifically endangering humanitarian workers? Well, seems that we have lost Mitch there for a brief second. But just to kind of latch off to what I was saying earlier, for listeners and viewers, the intensity of the situation, or the conflict rather, in Sudan between SAF, that's the Sudanese Armed Forces, and the Rapid Support Forces, RSF, in Khartoum, Sudan, which is the capital of Sudan, has escalated drastically since 2023. In 2024, we saw this intense fighting calm down a bit, as there was some winning from. Okay, Mitch is back. Hi, Mitch. Welcome back.
Sorry, my internet cut out. Sorry for that.
No problem. Welcome back. So yeah, I was just speaking to listeners and viewers, and speaking about the fighting between SAF and RSF since 2023, and in 2024 we saw it calm down, and now it's 2025. Has it escalated, do you think? And how is this endangering humanitarian workers on the ground?
Mm-hmm. Yeah, the fighting has really ebbed and flowed in different parts of the country since it began in April of 2023. Right now, we've seen a shift away from central Sudan toward the west. So the main front lines being in the Kordofan states, which is west of White Nile and Khartoum states. Very intense in that location. Due to the absence of many humanitarian actors and other organizations, we don't get very clear reporting or consistent information, but we do get reports of ongoing clashes that have affected civilians, that have driven wide-scale displacements. We've also heard of attacks on villages, on civilians. And the other point to mention is the ongoing fighting in Al-Fashir, which is a city in North Darfur and is under.
All right, Mitch Rhyner is still with us, trying to reconnect again. We're going to go to a short ad break, and when we get back, hopefully we can reconnect with Mitch.
Financial goals feeling out of reach? Yassin Badat Financial Advisory is here to turn your aspirations into achievements. Our dedicated team, armed with a history of success, is ready to guide you through the complex nature of financial and investment planning. Whether you're a seasoned investor or new to the game, our personalized solutions cater to your unique goals and risk appetite. Trust in our commitment to transparency, integrity, and excellence. Ready to unlock a world of financial freedom? Partner with us today. Call Yassin Badat Financial Advisory at +27 33 346 2071 or visit www.yassinbadat.com. Yassin Badat Financial Advisory, guiding you to financial success.
They say breakfast is the most important meal of the day, yet many children go to school hungry because of poverty. Penny Appeal South Africa's Breakfast Club aims to get a warm, hearty meal to underprivileged children so they can spend their day prospering in their schoolwork. Help feed a needy learner for only 5 Rand a day, or 150 Rand a month. Or visit our website www.pennyappeal.org.za or call 031 1100 573 to find out how you can donate. Penny Appeal South Africa. Small change, big difference. When the perfect blend of stylish decor, exquisite halal cuisine, and warm hospitality come together, it could only mean Al Bayt Lodge, your true home away from home. Al Bayt is the ideal heaven for families, business people, and tourists with its 4-star family rooms and other luxurious facilities, conveniently situated close to Port Elizabeth Airport, the beach, and other amenities. Your stay will be truly unforgettable, as you'll be taking home lasting memories of the warm hospitality, the serenity and tranquility that Al Bayt has to offer. For reservations, call 041 583 6415 or visit www.albaytlodge.co.za.
Abu Huraira narrated that he heard the Prophet Muhammad, may the peace and blessings of Allah be upon him, say, In Black Seed, there is a healing for every disease except death. Experience the health benefits of this ancient blessed seed by using the TIB Black Seed range. Black Seed assists the body to boost immunity, regulate blood sugar levels, reduce inflammation, and act as a potent antioxidant. Experience a holistic approach to health by introducing the TIB Black Seed range into your routine. Available in capsules, pure cold-pressed oil, and a vapor rub. Trust TIB Health Sciences for quality Black Seed products. For more information, visit blackseed.co.za. Available at leading pharmacies.
Hey Gulam.
Yeah?
Did I return your lawnmower last month?
No, bhai, you didn't.
Oh no. Now what'll I do? I wanted to borrow it again, man.
With Randry Jewelers, you won't have to borrow or lend because the prices are so well trimmed on all gold and diamond jewelry. Alternatively, we could remake your old jewelry into a brilliant new design. Visit Randry Jewelers at 151 Stevens Lamini Road, Musgrave, Durban. Randry Jewelers, the family name you can trust.
Rejuvenating media day by day. This is Salam Media.
Good morning and assalamu alaikum. Welcome back to the mid-morning talk with myself, Asiha Davids. We are tuned in with the Deputy Head of the Sudan Mission, Mitch Rhyner from MSF, that is Doctors Without Borders. And just before the ad break, we were speaking about the situation on the ground and how the conflict has evolved, escalated over the past 2.5 years. Mitch, thank you again for being with us. Just for listeners who joined in now, if we can just recap on what you were speaking about, that the conflict is moving towards West Sudan and in that region right now. And if we can maybe just expand on that and what Doctors Without Borders and humanitarian aid workers are experiencing on the ground.
Sure. Yeah. As mentioned, the front lines have shifted to the west. The Sudanese armed forces have taken back control of Khartoum, the capital city. What we've seen in Khartoum in the eastern states is an increase in access for aid actors to access populations, to provide services. And at the same time, we've seen more challenges with access in the West, particularly where there is fighting ongoing. So needs in Darfur and the Kordofans are the highest in the country, and aid actors and Doctors Without Borders are doing what we can to respond according to those needs.
Thank you so much for that. And if you can maybe expand on the hospitals that were destroyed or abandoned during this time. I can imagine that this obviously makes it harder for Doctors Without Borders, along with other humanitarian assistance on the ground, to operate and support civilians who were affected by the conflict and who are being affected by the ongoing conflict.
Yeah, so one of the features of this conflict that we've seen repeatedly has been attacks on healthcare facilities, so hospitals, clinics, even medical. Sorry, I'm having internet issues. This has made it difficult for us and others to provide services. Of course, for our safety, for our patient safety, we have to take measures to mitigate the risks of attack on health facilities. Also, as a result of deterioration in the situation, facilities don't have provision of water. It's difficult to receive supplies. Many staff working in hospital facilities with the Ministry of Health are not being paid regularly. Thus, for Doctors Without Borders, we not only have the healthcare provision and technical side of support, but we also have to consider the logistical, the administrative, the financing of salaries to consider as well. So the impact on the health infrastructure and healthcare system in Sudan has been incredibly detrimental. One estimate is that over 70% of healthcare structures have either been made not functional or are only partially functioning. So impacts have been quite devastating.
Thank you for sharing that with us, Mitch. I mean, again, this emphasizing the dire situation in Sudan, and um, I mean, and I'm interested to hear your thoughts on this as a humanitarian worker. Has media done enough, and international media, in covering the Sudanese crisis? Previous opinion pieces that I've kind of read up before this showed a great complaint that Sudan was not getting enough coverage. Do you think that this is contributing to the ongoing conflict? And how, and I mean, what message do you have to media as a humanitarian worker yourself?
The scale of the humanitarian crisis and the massive needs in Sudan require significant media coverage, and I think up to this point we haven't seen the level of media attention that we would expect for a crisis of this enormity and severity. So millions, over 10 million people displaced, declarations of famine last year and this year, entire cities reduced to a skeleton of what they were before, including Khartoum, the capital. These impacts and the impacts on people in particular deserve more coverage than they've been receiving. They should be in the conflict should be in mainstream coverage, daily. But instead, we see long stretches where Sudan is not in mainstream media, where the consequences on civilians is not covered adequately. And I would encourage media sources to do more to put focus on what is happening in Sudan.
Thank you for that. I mean, today's World Humanitarian Day. And I mean, I want to say congratulations for the humanitarian work that you're doing, but I don't think I don't know, but I doubt it would feel celebratory given the conditions that you are working under, and Doctors Without Borders. I mean, it's incredibly challenging, to say the least. I mean, for World Humanitarian Day, what message do you want to put out there to young people, to humanitarian activists? What message you want to put out there to them?
My message would be that although humanitarian work often isn't recognized or appreciated, the efforts of humanitarians and those working in service of others is remarkably important, and it is worth taking a day like today to reflect on that even though unrecognized, the value that we provide and the services and the assistance are beyond label. So important, despite difficult circumstances, despite challenges with administrative barriers, with bureaucracy. It's important to remember that what we do is important and is appreciated, even though it's not always clear.
Thank you for that, Mitch, and I'm sure that message resonates with a lot of humanitarian workers around the South and around South Africa as well. Before I let you go, I just want us to touch on, given that it's also Women's Month in South Africa now, and we've been exploring how in wars women and children have been disproportionately affected, and in Sudan this is no different. There were also reports that the RSF then denied, that came out that's saying that women were raped during this war, and just the intensity of the conflict on the gender-based violence and on women in particular. I mean, is this something that you can comment on the situation on the ground?
Yes, we've seen horrific rates of sexual and gender-based violence in this conflict. just shocking numbers in Darfur in particular, but also in other parts of the country where there's a breakdown in rule of law, where particularly during shifts in territorial control, there is kind of absence of authority. And we, MSF, provide medical care to many of those survivors of sexual violence. It's been used as a weapon of war as well, and it's unfortunately something that continues. So certainly a massive problem, and something that requires attention, requires supports for survivors of sexual violence, not only medical care, but also services related to protection, to help people get back on their feet and deal with the consequences of what they've seen and experienced. And then the other element, with the negative impacts on the healthcare system and medical facilities, we've also seen alarming maternal mortality rates. And one of our main focuses in South Darfur in particular has been to support the recovery of sexual and reproductive health services in hospitals and also in clinics. So that has also been, unfortunately, a victim of this conflict, is services for women, for pregnant women. And again, that's an area where more attention and support is needed in Sudan.
Thank you so much for that. That was Mitch Rhyner, Deputy Head of the Sudan Mission Doctors Without Borders, better known as MSF. We explored the conflict happening in Sudan and the dire consequences on the healthcare system and women and children. Thank you so much for joining us, Mitch.
Thank you for having me. Thank you.